All right, let me just make this bigger. All right, can you see my screen?
Yes.
Perfect. All right, good evening, everyone. My name is Dr. Doneisha Dodd. I'm a naturopathic doctor. I am in Ontario, Canada, and I'm currently practicing close to the country's capital in Ottawa. And this evening, I'm going to be sharing some information on breast cancer with you. We're going to talk about what breast cancer is, and we'll go through some of the symptoms of breast cancer. We'll talk about some of the conventional treatments for breast cancer, and then we'll touch on some integrative cancer treatments as well. So let's get right into it. So cancer is a normal response to an abnormal environment. And so basically what we want to do is figure out, why do we have cancer and what's the actual cause so that we can be better able to know what to do. So breast cancer is when we have abnormal cells growing in the breast, and they usually grow uncontrollably and they form a tumor. Now, the stats here that I have are for Canada, but you can sort of translate them to the US as well. So breast cancer is the most common cancer diagnosis in Canadian women over 20, and it's the second leading cause of cancers in Canadian women. Now, if we look at the breast tissue, there are certain things that we want to establish. So usually one breast is smaller than the other. Breasts can feel more lumpy during certain periods of life, such as just before your period. When you're younger, your breasts do feel denser, and there are changes that occur to the breast during pregnancy and at menopause. We also want to take a look at the lymph nodes. So the lymph nodes, they're part of the immune system. And so cancer cells can actually enter the lymphatic system as well. So where does breast cancer start? So it can actually start in the cells that line the milk duct. So here's a milk duct here. So it can start in here, and it can also start in these lobules here, right? Now, there are various symptoms that we can have with breast cancer. So the most common one is feeling a lump in the breast or in the armpit, but you can also have changes to the breast itself. So there can be redness in the skin. There can be dimpling or puckering of the breast, and I'll show you some pictures after. You can have some scaliness or changes to the nipple. You can have discharge from the nipple. You can have nipple changes, so the nipple can be pointing in different directions. You can have ulcerations of the breast or the nipple, and you can have thickening of the skin that sort of looks like an orange peel. So here are some pictures. So if we look here, we're seeing redness on the skin itself. Here we can see a lump in the breast. So you can have a lump in the breast or a lump in the armpit. You can have swelling as well. This is the orange peel texture, so we definitely want to get these checked out. Here's an example of dimpling. Any form of discharge. So of course, if you're not breastfeeding and you are having discharge, that's cause for concern. And then we have different positions of the nipple. So the nipple could be pulled in, or it could be pointing in a different direction other than pointing forwards. You can also have ulcerations of the nipple and scaliness on the nipple and the areola. So if you ever notice any of these changes, it's really important to get it checked out and not ignore these signs. So what are some risk factors for developing breast cancer? So the first four increase your risk or are the highest risk factors. So if you have a personal history of breast cancer, so if you've had it before, you have a higher risk of having breast cancer again. If you have family history of breast cancer or other cancers, that increases your risk. And also if you are a carrier of certain gene mutations, and if you've had exposure to chest radiation before the age of 30 or within the last 8 years, that can increase your risk. If you have dense breasts, that can be concerning. So remember, I said that when you are younger, you tend to have denser breasts. And so it can make it harder to find lumps or any changes that might be occurring. Reproductive history can be a factor. This is usually related to the amount of estrogen exposure that you have. Hormone therapy is a factor. So whether that's bioidentical hormones or even contraceptives that we have here. Atypical hyperplasia, so that just means overgrowth of tissues. Being overweight and obese, that can be a risk factor. Alcohol use. Your diet does play a role in cancer development and progression. So especially when you have a high fat diet, or if you're not able to regulate your blood sugar really well, that can increase your risk for developing cancers. Other risk factors, so physical inactivity, so having a sedentary lifestyle, smoking, lack of sun exposure, night shift work, exposure to xenoestrogens. So xenoestrogens, these are synthetic estrogens that are found in a lot of products. They can be found in cosmetics, they are in pesticides, and so they actually bind to the body's own estrogen receptors and can cause harm. Breast implants and stress are two other risk factors. And we know that stress pretty much affects, every condition, and it's a risk factor for all conditions. So we definitely want to manage our stress levels well. So let's talk about smoking. We're going to talk some more about some of the risk factors. So smoking causes at least 15 different types of cancers, including breast cancer. And tobacco is the biggest cause of cancer in the world. Okay. And so the number of cigarettes and the number of years you smoke increases your risk. So here in this little schematic here, it says, how can smoking cause cancer? So we know that smoke or cigarette smoke releases many chemicals. This says over 5,000 different chemicals in the body. These chemicals go into the lungs and they can damage our cells, damage our DNA, and it makes it harder for these cells to repair. And so this DNA damage can lead to the development of cancer. Being overweight or obese, this is the second biggest cause of cancer. And this causes about 13 different types of cancer, including breast cancer. So here, what we see is that our fat cells, they are, they are not passive cells. They're actually active cells that can produce inflammatory chemicals. So they cause inflammation, they can affect our hormones, and they actually increase growth factors. So they cause things to grow, right? And so we do not want our cancer cells to grow, and we don't want our cells to proliferate to that extent. And so when we have excess fat, especially around our internal organs, then this can lead to inflammation, which increases our risk for cancer. Next, we have foods that we're eating. So what's the evidence for meat and cancer? And so processed meat, so this would include things like bacon, salami, sausages, and hot dogs. These are actually a part of the carcinogenic classification of foods. And so it's a part of group 1, which shows that these foods can actually cause cancer. Okay. Now, other meats such as red meat, so pork, beef, and lamb, these are probably carcinogenic. And so we need to be aware of this when we're thinking about cancer and our diet and the best diet for us, either to prevent cancer or to prevent the recurrence of cancer. So talking some more about meat, so there are different chemicals that are found in meat and chemicals that are added to meat when it's cooked or processed. Chemicals like nitrates and nitrites are added to meat to make it fresher for longer. There's a chemical called heme that helps to bring out the color of meat. And there are other chemicals, heterocyclic amines and polycyclic amines, that are produced when meat is heated at high temperatures. And so these chemicals obviously are going to affect us, and they can, also lead to the progression of cancer. Alcohol is another one. So drinking less alcohol can prevent up to 7 types of cancer. And we see that breast cancer is one of those cancers. Now, there is no safe dose of alcohol. And so it's important for, us to be aware of that, because many people, they drink socially, but we always want to think about, our health and what's important to prevent conditions such as cancer. So there are 3 ways that alcohol can cause cancer. So first, it can damage the cells and prevent them from repairing appropriately. And then these chemicals will cause the cells to divide more, because we're affecting the cellular structure and we're affecting their DNA. And so this increases the chances of cancers developing. And and alcohol makes it easier for cells in the mouth and in the throat to absorb cancer-causing chemicals, because the cells in the mouth and the throat are being damaged, so they're not going to be working optimally. And so we're able to absorb these harmful chemicals. So there are certain genes that are associated with cancers. So BRCA1 and BRCA2 genes, these are tumor suppressor genes. But when there is a mutation, it can cause cells to grow and to divide. So many people, they get gene testing to see if they have these genes present. So just some information here on breast cancer screening. And again, this is for Canada. So the recommendation on screening in women, sorry, is between the ages of 40 and 74. And so if you are 40 to 49 years old, the recommendation is not to be screened with a mammogram. However, the decision can be made between you and your healthcare provider if there are certain risks or benefits to doing screening during that time. If you are between the ages of 50 to 69, screening is recommended every 2 to 3 years. And if you are between the ages of 70 to 74, screening is recommended every 2 to 3 years. Now, for certain women that are high risk, so these would be individuals that have a personal history of breast cancer, a family history of breast cancer, have those genes for breast cancer, or have been exposed to radiation, they can have screening once a year with mammography. Now, even though breast cancer screening isn't recommended for certain populations, it is still important for you to know your breast, know what it looks like, know what it feels like, so that when something abnormal shows up, you were able to recognize it quickly. And so here I'm just showing you a few ways that you can do your own breast examination. So the first way is by looking. So you're going to stand in front of the mirror and you're just going to have your hands by your side and you're just going to observe your breasts. So you want to look at the color of the skin, you want to look at the nipples, you want to look at the areola, and you're looking for some of those symptoms that I described earlier. Then you want to put your hands on your hips and observe your breasts again, and then put your hands behind your head. So that's how you will do it, just by looking. And then you're going to do it by touching. And so you're going to do one breast at a time. And so you can do it in lines going up and down. or you can do it in small circles, going from the outside of the breast to the inner part of the breast. And you can also do this in a wedge direction. And then you can also do it lying down because then the breast is flatter and you might be able to feel things better. So you can do it lying down, and this woman, she just has like a little pillow or something just lifting her shoulder up a bit. And when you are doing it lying down, you also want to test or check your lymph nodes. So you'll check the lymph nodes in the armpit and also in the clavicle area here. So this is just some imaging showing different densities of breast tissue. And so in this breast tissue, it's not very dense, and so it's easier to identify, a tumor or a growth that might be occurring in the breast. But as you can see, women that have denser tissue, it's going to be harder to identify anything that's growing. And so that's why it's really important for you to know what your breast looks like, what it feels like on a regular basis. Even when you're menstruating, um, you want to feel your breast during that time as well to know what is normal for you. So we're gonna talk now about some conventional treatments. So the treatment that most people are familiar with. So it's usually surgery, chemotherapy, and radiation. So we'll talk about that now. So first surgery, so surgeries can be done either before or after chemotherapy. And the surgeries are either a lumpectomy, so just removing the tumor itself, or a mastectomy, so removing the breast. So it could be removing one
Okay,
breast
wait.
or removing both breasts. It all depends on what the situation is. There can also be reconstructive surgery, depending on if the person did a mastectomy. And then lymph nodes can also be removed, depending on if those lymph nodes had cancer cells as well. Talking about chemotherapy, there are a variety of chemotherapy drugs. I'm not going to go through all of them, but we all know that chemotherapy is one form of therapy that is used most commonly. There are some short-term side effects of using chemotherapy. We're mostly familiar with people being fatigued or losing their hair. But here are some other side effects that you may not know. So we can have digestive disturbances, so whether diarrhea or constipation. There's also nausea and vomiting that can happen. There can be changes in nerves, so affecting brain function or taste. You can have numbness and tingling. It can affect sleep. You can have sores in the mouth or ulcers, loss of appetite, hand-foot syndrome, and it can definitely affect red blood cells and your white blood cell count. And of course, you want your white blood cells when you are trying to get rid of something in the body. But it is important to know that there are side effects to these treatments. So those were short-term side effects. There are also long-term side effects as well that can lead to heart damage or fertility changes or neuropathy. So like numbness and tingling that can occur in the limbs. There can also be mental health concerns that can come up with chemotherapy. And so as I'm going through this presentation and talking about the side effects for different therapies, I am not saying that you should or shouldn't use this form of treatment. I'm just giving you an overview of what is available. So next is radiation therapy. So with radiation, they're using X-rays to actually give a focused treatment to that area. And so with radiation, there is cellular damage that's occurring, and the goal is to actually destroy those cancer cells and to prevent the risk of recurrence. They're usually a few sessions for the week, and they can last about 15 minutes each, but these sessions are tailored specifically to the individual. Again, there are short-term and long-term side effects. So with radiation, you can get dermatitis, So skin changes, you can also get fatigue, and you can also have changes to the breast as well. Long term, there can be more fatigue, changes with the thyroid function. There can be lymphedema, so there can be some swelling. Um, Radiation to the breast can also affect the lungs, so that's radiation pneumonitis. It can affect the heart, so there can be cardiovascular concerns because the lungs and the heart are close to the breast. And there can also be secondary cancers that can arise from radiation. Endocrine therapy is another form of treatment. This is given to patients that have estrogen positive cancers. And so these types of drugs, basically what they're doing is they are decreasing your body's estrogen, especially if the cancer is hormone based. And so this type of therapy can be done after chemotherapy or surgery. And this is something that these are drugs that are given orally, and they can be given for a prolonged period of time after diagnosis and after chemotherapy and surgery. So the side effects of endocrine therapy are sort of going to be similar to menopause, because in menopause our estrogen declines. And so if we're giving drugs that are lowering estrogen, it's going to be similar. So patients will experience hot flashes, loss of libido, vaginal dryness, cognitive changes, so trouble with memory, thinning hair. They can have changes with muscle function and bone loss. So all those symptoms are very common with menopause. There can be ocular changes, so changes to vision, thromboembolic events, so things like developing blood clots, uterine malignancies, so cancers in the uterus and in the endometrium. There can be diabetes, and there can also be high cholesterol. Now, again, when individuals take these forms of treatments, it doesn't mean that they will develop all these symptoms. So just be aware of that. And then even with endocrine therapy, there can be long-term symptoms that can affect the person's physical health, their, quality of life, their function through their day-to-day life. It can affect them emotionally and psychologically. And so it's really important when patients are being treated with cancer to treat them as a whole and to also support them physically, mentally, and emotionally. So now I want to transition into some integrative treatments that can be used when patients have cancer. And so we're going to focus on some of these here. So we all know that the food that we eat is very important. So we're going to touch on the nutrition. We're going to touch on the impact that exercise has with cancer. We'll touch a bit on water, sunlight, with temperance. So temperance is basically avoiding things that are harmful and having the good things in moderation. So some harmful things that we've touched on already would be avoiding smoking, avoiding alcohol, watching your meat consumption. And then we'll talk about air and being outdoors, and we'll talk about rest and trust in divine power. So first looking at nutrition. So this is specifically for breast cancer. So we want to be focusing more on our vegetables and our plant foods. So we want to have at least 5 servings of combined fruits and vegetables on a daily basis. And then there's specific foods like flax seeds that are very beneficial for breast cancer. So flax seeds have been shown to decrease cancer cell growth. They're very protective. They're beneficial for reducing hot flashes. And the dose for that would be about 2 tablespoons. And this would be ground flax seeds. Ideally, you want to store your ground flax seeds in the freezer to keep them fresh and away from light. Soy is also beneficial for breast cancer. When it comes to soy, we want to have organic as best as possible. You want to have 3 servings or less of soy per day. So that can include soy milk. So if you're looking at soy milk, 1 serving would be about a cup of soy milk. you're looking at tofu, one serving would be about 3 ounces. And for edamame, that would be about half a cup of cooked edamame. And so soy is associated with a decreased risk in breast cancer development, but it also decreases recurrence of breast cancer and deaths from breast cancer. So soy has a lot of benefits. Protein intake is very important, so especially when patients have cancer. Sometimes we know that people experience muscle wasting, and so it's really important to ensure that people maintain protein adequacy when going through treatments. Nuts are very beneficial. We know that they are a source of healthy fats, and they can help with overall disease-free survival from cancer. Next, we are going to look at fiber. So fiber is very important, not just for our digestive health, but fiber is very important to maintain the good balance in our gut between our good versus our bad bacteria. And so we want to ensure that we're getting lots of fiber every day, and all of our plant foods have fiber. And so if we focus on increasing our fruit and vegetable intake on a daily basis, then we'll be able to meet our fiber goals. The ideal is to have greater than 30 grams of fiber per day. Okay. Another thing that can be beneficial is fasting. So there are different types of fasts that can be done. An overnight fast can be beneficial. Some people do 12-hour overnight fast. Some people do up to 16 hours overnight fasting. You can also do weekly fasts. So once a week, you can do a fast, or you can decide to do a fast for a week. So there are different options. But what happens during fasting is that it actually gives the body a break from digestion. And so digestion requires a lot of energy. And so when we're fasting, the body is able to use those resources to help repair and get rid of, cancer cells that might be hiding out or around in the body. And so fasting can be a simple way just to help to get a reset. Now let's talk about exercise. So postmenopausal women who are overweight actually have an increased risk of breast cancer. And so exercise is very important because it reduces your risk of cancer. And the recommendation is 150 minutes per week of exercise. And so when we do this, it helps to improve joint pain and pain that's related to aromatase inhibitor. This is one of the drugs that's given with endocrine therapy. So exercise can actually help with that. Exercise also helps with the swelling that people experience. So usually when they remove the lymph nodes, there can be swelling in the arms. So exercise can help with that. And exercise also helps with fatigue. So I know a lot of times when people feel tired, they don't want to exercise, but actually exercise helps to give you more energy because it actually produces more mitochondria. And the mitochondria is the powerhouse of the cell. So that's what's actually creating the energy. So the more you exercise, is the more energy you'll have. Physical activity actually helps to reduce your BMI. It helps to maintain blood sugar balance. It helps to reduce inflammation. It helps to manage your stress hormones. And all these factors contribute to cancer development. And so if we're able to engage regularly in physical activity, then we'll be able to reduce inflammation and reduce all those harmful things that can contribute to cancer development. Exercise also helps to improve immune function. And so if someone is struggling with cancer, it's really important to find some way for them to get some physical activity in. Exercise also reduces side effects from cancer treatment, so like chemotherapy and radiation. It helps to improve quality of life, and it reduces the risk of recurrence because, again, it's going to help to improve your immune function. And so that's really important when we're talking about cancer. Next is water. We all know that we need to drink water, we need to stay hydrated, and our cells can only function appropriately when they have enough water. And so many people, instead of drinking water, they focus on drinking other beverages. So sugar sweetened beverages, sodas, pop, alcohol, coffee, and all these things are dehydrating the body. And so the body cannot function optimally when it's dehydrated. Also, when we're having sugar sweetened beverages and when we're having them on a regular basis, this is actually affecting our blood sugar regulation. And when our blood sugar isn't well regulated, this can lead to things like insulin resistance, which is one of those risk factors for cancer development. So we definitely want to reduce our sugar sweetened beverages and focus more on drinking water. I mean, I've had patients say to me, "Oh, I don't like the taste of water." And, I try to give them options, but water is the one thing that, you know, I make people drink their water because there's no way that you can be healthy if you're not taking water. And of course, we want to eliminate alcohol, as I showed earlier. Alcohol, there's no safe dose of alcohol, and it is also a risk factor for developing cancer. So sunlight. So vitamin D is very important, especially for those of us living in North America that don't get a lot of sun exposure. But vitamin D deficiency is associated with increased breast cancer risk. And decreased vitamin D levels result in high cellular growth. So it causes those cancer cells to grow. It causes neoangiogenesis, meaning that it causes new blood cells to go to the cancer and it causes cancer development. So we don't want those things to happen. So we want to ensure that we're getting enough vitamin D. So if you live in an area where you have access to sunlight all year round, then definitely go outside and get your sun exposure. If you live in areas in North America where there are issues with that, then you definitely want to supplement with vitamin D. Vitamin D helps to improve survival rate and decreases overall mortality. So vitamin D is very, very important. Vitamin D also improves immune function. So since we're going into the cold and flu season, it's always good to ensure that you have enough vitamin D. Sleep is also very important. So there is circadian rhythm disruption in patients that have cancer, including patients with breast cancer. And so when our sleep is not well regulated, then we don't produce enough melatonin. And so we know melatonin helps to regulate that rhythm, tells us when to go to bed. However, melatonin also has other benefits. So it's an antioxidant, so it helps with cellular repair. It's anti-carcinogenic, so it helps fight cancer cells, and it also helps to boost the immune system. So we definitely want to ensure that we're getting enough sleep at night because we know that when we are sleeping, that's when our body is actually doing all that repair and cleaning up. Here are just some tips that I'm sure you already know, but you want to establish a nighttime routine or a bedtime routine. You want to ensure that your room has a cool temperature, that it is dark, there's no light coming in through the windows. You want to reserve the bedroom for sleep and intimacy, nothing else. If you want to relax, you can do deep breathing exercises just to bring stress levels down and bring your nervous system into a calm state. Some people choose to light candles or use diffusers. You want to avoid eating late at night. So I tell people no meals 3 hours before bed so that you are not digesting food when you should be sleeping. And of course, avoiding caffeine as well and alcohol. Ensuring that your bed is comfortable. So whether checking a mattress or the pillow, you want to sleep in a quiet environment. You don't want any disturbances and avoiding exercise close to bedtime because exercise is stimulating. So there are some supplements that people commonly take for sleep. So of course, melatonin is a very popular one. Another one is glycine. And then other herbs that are good for, calming the body for sleep would be chamomile, valerian, passion flower, and lemon balm. So some of these come in like combined products, so you can buy them separately. The only thing with drinking tea at night is that you're more prone to get up in the night to use the bathroom. And so because we don't want to disrupt sleep, it's better to the um, drink the tea earlier or drink a small amount or probably consider having a capsule. So stress management is very important. We know that stress increases your risk for many diseases. And so a few things you can do for stress management would be diaphragmatic breathing. So, inhaling, but ensuring that your exhale is longer than your inhale. That can be very calming for the body. Exposure to nature, so that can be good. And even looking at images of nature actually help to reduce stress. That's what this 2016 study found. But the best thing would be to go outside, so being outside in nature helped to improve mental health versus, living in a busy area. And we've all heard of forest bathing. So being outside in the woods, being in nature, it's very therapeutic. So not just, inhaling the fresh air, but also inhaling the scents and the aromas from the trees and the pines can be very therapeutic and beneficial. And it also helps to improve your immune function. It makes you feel, happier and less stressed. So if you have the ability to go outside and be in nature, that's very good. There are some supplements that can help to manage stress. Ashwagandha is a very popular one, and rhodiola. Passion flower and valerian can be good as well. So it all depends on your preference and what your goal is when you're thinking about stress management. Other things could be journaling, taking a bath, seeing a counselor if you need help with certain things that are causing stress in your life. So those are some options, but it's just important to find something that you can do consistently to help manage your stress levels. Other treatment options. So we did talk about melatonin. So melatonin helps to improve sleep. It helps to inhibit growth of cancer cells, but it also can reduce peripheral neuropathy that can happen with chemotherapy. So it has other benefits. It can improve fatigue that comes from chemotherapy and radiation. And melatonin is used in postmenopausal patients to help with sleep. Ashwagandha, so we mentioned that earlier to help with stress management, but it can also help to reduce fatigue from chemotherapy, and it improves overall quality of life. L-glutamine is a form of an amino acid that's usually used for digestive concerns, but it can help to reduce oral ulcers that you can get from chemotherapy and help with muscle wasting. Magnesium is also good for fatigue, and it can also help with sweating from endocrine therapy. And then there are some other herbs like black cohosh that can be beneficial to decrease hot flashes. It can also be used with tamoxifen. That's one of the medications used in endocrine therapy. And red clover can be beneficial as well because it can help to reduce BMI and waist circumference in women being treated with breast cancer. Evening primrose oil may also be beneficial for reducing night sweats and hot flashes. And then we talked about vitamin D. The only other thing is it can help to reduce bone loss in women that are doing endocrine or hormone therapy. Omega-3s are always good to have. And so omega-3s help to lower pain scores. And then medicinal mushrooms can be beneficial as well. So reishi or Ganoderma help to improve quality of life and fatigue from endocrine therapy. And turkey tail or Coriolis helps with fatigue and lymphocyte count. So that's one of your white blood cells. Now, IV vitamin C or intravenous vitamin C can also be beneficial for people that are going through cancer. So, when people have cancer, they have oxidative stress. So, there's cellular damage that happens and there's inflammation. And what they've noticed is that cancer patients tend to have lower levels of vitamin C. And when they're at higher stages of cancer, they tend to have even lower vitamin C levels. And so when your vitamin C levels are low, it's linked to lower survival rates and a lower quality of life. And so intravenous vitamin C can help to lower inflammation. It can help to improve antioxidant stores and improves quality of life. And it can be done before or after chemotherapy treatments. And I just want to quickly touch on mental health. So, mental health and physical health are very important. And so hopelessness is something that many patients experience, especially with a cancer diagnosis. And people that feel like they have a purpose, they've actually found that there's decreased inflammation, decreased tumor progression in these patients, and they have better stress responses and better sleep. Your social environment also plays a role in your prognosis for breast cancer and in, the progression and how it affects tumor growth. And really quickly, I just want to touch on spiritual health. A lot of the times when people get diagnosed, they say, why me? Or what did I do to deserve this? Or why is life so unfair? Or how am I going to live with this? And, these are valid questions that these individuals have. But, the only way that people can get through this is by having a good spiritual health. And so they've done a bit of research on this, and they found that spiritual distress or feelings of abandonment by God and or one's religious community is associated with increased depression, decreased adherence to medication, and medical advice among cancer patients. And so we see that, having a relationship with God or having a good spiritual foundation can actually affect your mental health, and it can affect your treatment and your perception of the benefits of those treatment options. And religion and spirituality is associated with better physical health outcomes in cancer patients. Now, I just want to quickly touch on some other treatments that people may have heard of. SCAC is a really popular one. It contains a few herbs that are good for liver support. And so that's really popular. I've even seen it in Walmart now. Soursop leaf tea, that's another one that many people say, or I've heard some people say, they just have that alone and it's beneficial. Not everyone is different, but these are, natural options that people have tried. Castor oil packs. So these are cloths that you put castor oil on and you put it over the area that has whether the lump or the tumor. And over time, the castor oil, because it penetrates deeply into the skin, it can help to, break up lumps and bumps. But this is something that you have to do on an ongoing basis. Hydrotherapy treatments can be beneficial as well. So one of them is the fever bath. So the goal of the fever bath is to create a fever in the body. And the reason you're doing this is that this will activate the immune system to actually go around and start, killing and getting rid of anything that should not be there. Fever baths should only be done under medical supervision because people can faint, they can get dehydrated, and you want to be very careful with that. And then hot and cold compresses can be used as well. So there are some people that they'll apply. So heat brings blood to the area and cold pushes blood away. And so people will apply cold to the area of the tumor and they'll add heat to the opposite area so that the blood is rushing away from the tumor. So those are just some other treatment options that people have used. And lastly, I just included this. I actually listened to a woman that had breast cancer, and she said that this was something that she used on her breast cancer on a daily basis. And she called it a breast rub. It's basically Jamaican black castor oil, extra virgin olive oil, frankincense oil, peppermint oil, and she mixed that together. Just know that castor oil and coconut oil can stain, and so you want to be careful with whatever you're wearing when you apply this. These are just, natural remedies that you can try. I don't see any harm in trying these things. You just want to make sure that the area you're applying it to is clean, and that it's safe to use it there. And so lastly, I just want to say it's really important for you to know your breasts. You want to know what they look like, what they feel like in different stages of life. And so after the call today, you can probably do a breast exam just to reacquaint yourself with your breasts. But just know that if you ever find something that is abnormal, that you should definitely get it checked out, and that you shouldn't wait. So I just want to say thank you for listening to my presentation today or this evening. And I will stop sharing my screen and open the floor for questions if there are any questions.